Hi, this is Dr. Paa-Kofi Obeng with the To the Moon and Back Foundation. Hope you're all doing well. Just want to talk to you a little bit about blood pressure. Blood pressure is something that we screen for primarily in primary care, very commonly in our patients. As it's well known, blood pressure can affect so many health issues, such as down the line, such as things of like heart disease, like strokes, heart attacks, things of that nature. So a lot of times your primary care physician will screen for high blood pressure. It's recommended that people who are between the ages of 18 and 39 be screened for blood pressure roughly every 3 to 5 years, depending on whether or not they have an elevated blood pressure. And anyone above 40, it's recommended to get screened above annually. Now, for our blood pressure recommendations, according to the American Heart Association, combined with the American College of Cardiology, it's recommended that on average, blood pressure the goal be around 130/80 or less. In terms of criteria for blood pressure, normal is between 120/80. Elevated is considered between 120 to 129. Stage 1 hypertension is about 130 to 139 for the systolic or the top number. And then anything above 140 is considered stage 2. So typically what your doctor will do, they will screen you and they'll actually do multiple readings, not just one reading, but they'll usually do 1 or 2 readings to confirm whether or not someone has high blood pressure. It's also recommended from the U.S. Preventative Services Task Force that people also screen for high blood pressure at home. So that would be someone taking their blood pressure after they've been seated for about 5 minutes and getting a proper reading. I typically do that in my practice too. I have patients check their blood pressures, and I even have my nurses follow up with them in terms of elevated blood pressure before I start my medication. So key things take home. Whenever you go see your primary care doctor, you want to make sure they're checking your blood pressure regularly, especially if you're above 40, and that they're monitoring it closely. If you do have multiple readings above that 130/80 threshold, usually it's time for lifestyle. Number one, that would be things like walking, exercising. The other things would be medications, but we always recommend lifestyle interventions first before moving on to medications. All right, I hope that is of use and helpful to you. Wish you all the best. Take care. Bye-bye.